It is estimated that 1 in 3 women develop a pelvic floor disorder at some point in their lives. So what is it and what can you do about it? Well, this afternoon we have Dr. Humphrey Atiemo, a urologist at ProMedica, who also specializes in female pelvic medicine and reconstructive surgery. Thanks for being here today.
Thank you.
You know, this is the thing, man, this is the thing that we all kind of deal with and nobody wants to talk about, right? Especially for women who've probably had babies, right?
Yes. Well, pelvic floor disorders are very common, particularly after childbirth. It affects maybe 50% of women after childbirth will have some type of disorder, whether it be incontinence, loss of bladder control, things like that. Sometimes issues with their bowel movements, and also just loss of the pelvic floor, which is dropping of the pelvic floor with standing and physical activity.
So are these, is this serious? Are these treatable?
Most of these issues are quality of life issues. Most women spend a lot of time just dealing with it, but they're all very treatable. And I think that's the big message for today, is that most women can be treated successfully if they identify this disorder and then come in to be evaluated.
Yeah, so I think, it's things like coughing and sneezing and maybe doing some jumping jacks, some physical activity, right? So, what are the different types, I guess, of these disorders?
So we'll start with incontinence. So you have stress incontinence or urge incontinence. When we say stress, we really mean physical activity. So maybe picking up your kids, walking the dog, walking on the treadmill. Those types of sudden movements can cause leakage. Urge incontinence is more like I have the urge to get to the bathroom and I don't make it in time and I'm already wetting myself. So that's typical incontinence. Pelvic organ prolapse is more so I feel something dropping in the vagina, and sometimes when I go to the bathroom I can feel something hanging out, and that may be the uterus, it may be the bladder. It's hard to tell without an evaluation, but those are the most common disorders that we see.
And so at what point, because I think many women will just say, well, this is just normal, right? I mean, this is what happens. So at what point, though, should a woman say, you know what, I don't really want to live like this anymore?
So I'll be specific. For women who've had childbirth, typically we give them about a year.
Okay. 1
year to recover from childbirth, kind of get everything back in shape. But if your symptoms persist longer than that, then you should seek evaluation. Incontinence can happen at any age, even before childbirth. There's some women who've never had children and they have bladder control issues. So I think if it bothers you and it's impacting your quality of life, you should seek evaluation.
So what can be done? Because I think, during pregnancy, things like that, you hear about Kegel exercises, that kind of thing. What can you do, when we start having these issues?
So Kegel exercises are great. More broadly, we call them pelvic floor muscle therapy. And we have some great therapists in the system that we refer patients to really get them in touch with their pelvic floor, to learn how to tighten and control those muscles. They can help with the incontinence symptoms. They can help with the prolapse symptoms. For patients who have more severe incontinence issues, there are procedures either in the clinic or surgeries that we can perform to help with those symptoms.
Okay, so there could be cases where you need to do a little bit more, probably,
exactly, yes.
than just learning how to strengthen those muscles.
Yeah, in general, we start with pelvic floor therapy because it's innocuous, it doesn't hurt anybody, and some women are very good at them and they can resolve everything. But in some situations, you just want to get fixed, you want things to be better, or you've been living with this problem for such a long time, you're ready to live again, and then you want to seek evaluation for that.
Yeah, talk a little bit about the patients who come to see you. How do they feel, and then how do they feel when they're treated?
In my practice, I see patients from age 18 to 95, and so the whole spectrum. And many women are very happy when they have their life back. They're dry. I just had one patient that mentioned that she could go on a trip with her daughter. They didn't have to pull over 5 times during the drive. Yeah. So I think it really impacts their quality of life when you treat the incontinence and the pelvic floor disorders.
Yeah, and I mean, even like little things like maybe some of the clothes you wear, or you're trying just all the time to cover things, or
Exactly. I've had several patients who've come to clinic and they only wear black pants in case there's an accident. It hides things, or they bring an extra change of clothes to work because they're worried about having an accident. And I don't think women should live like that. It's nice to know that there's a way to fix that problem so you can get back to regular living.
How would you encourage women to make that step? Because yeah, it is the thing that we don't want to talk about, and it's kind of embarrassing.
Yeah.
So, you know, how do you encourage them?
I think the best thing is when you meet with your primary care doctor, you can bring it up as an issue. Most primary care doctors know a little bit about it, and they know when to refer if it's more than what they can handle. Other than that, you can make a direct appointment with a specialist like myself. We'll do an evaluation and get you on the road to recovery.
Okay, so you don't have to live like this, ladies, right? You can,
Yes, very
you
much
can get
so.
back on a trampoline maybe
Yes, very
someday,
much so.
right? Or you can, you know, all these parks with your kids and doing all of these activities and not having to worry about it.
And it's the biggest thing when you change somebody's life. They get the enjoyment back. They can do things with their family, with their kids, and they don't have that fear of having an accident. And that's a big thing, and you should pursue that happiness in your life.
Wonderful. Doctor, thank you so much for being here today.
Thank you.
We appreciate it.